Hi, my name is Dr. Brian Butler. I'm Chief of Radiation Oncology at Methodist Hospital. I want to tell you about an exciting new project called Plato's Cave. Plato's Cave is a platform that has been created by stepping outside of the normal healthcare silo or environment. We have reached out to gamers, computer scientists, and nanotechnology people to try to look at data in a very unique way. The data I'm talking to you about is data that is imaging data, CT, MRI, and PET imaging. We're going to take this data in a very specific way and look at it. Now, one of the fundamental questions a physician will ask is, what does the patient look like on the inside? Well, what if I could take these images, because they're all written in the same language called DICOM, and reconstruct them? And we can now see a history of how imaging has developed over time, from very poor imaging radiographs where little was seen. And you have to remember, prior to 1980, patients were basically operated on by just looking at plain films. The evolution of the CT scanner, and for which Cormack and Hounsfield won the Nobel Prize, allowed us to see more into the patient's body, but only in a grayscale, where we take slices through the patient's body and look at different slices. Now, we moved forward as we took these slices and stacked them on top of each other to create a three-dimensional image. And now we could look inside the body in 3 dimensions, outside shades of gray, and now color. Well, what if we went a step further to looking at images in 4D by taking these images and using very sophisticated algorithms? Now we can look at a valve moving and a heart beating. And this requires a supercomputer. The next step would to go to the next dimension of 5D, of now looking at blood flow through the heart while a heart is beating. And now as we look at this next image of an abnormality of a patient that we've reconstructed in 3 dimensions, and we can see a small narrowing within a blood vessel and an aneurysm. And this is extremely important for the patient's understanding as well as the physician's understanding. As we move forward even further, what if we could look inside that blood vessel that's abnormal and see what it looked like on the inside, how much plaque there was on the inside and how much abnormality there was, and interrogate that data and start to make what we call quantitative measurements. Well, as we move further to the next image of a valve that's moving and looking at to see how abnormal that valve is and disease that particular valve may be, we can now see it in 4 dimensions and connect this 4-dimensional movement of the valve to a sound. And after that, we can even move to 5 dimensions where you can now see this beating heart. The beating heart, and you can look at the blood flow through the heart and give some idea about the disease process and visually understand the disease process as a physician and as the patient. Now, this data becomes extremely important to be part of the patient's electronic medical record, because this platform is being evolved for decision-making, education, interaction, and research. So let's look to see how we can possibly interact with this data. It's great to look at it before you go in the operating room, but what if we could look at it while we're in the operating room, utilizing voice commands and hand gestures? What if we could plan on a virtual surgical table before taking the patient to the operating room? What if we could interact with that data and not have just one single user interact with the data, but 4 users interact with the data or more? What if we could interact with the data by moving it around via voice commands? So one of our goals is to look at data, make quantitative measurements, as you can see here in this last slide of a valve measurement, and deciding on what valve side is needed to be used to replace this particular valve. As you can see, the valve motion and the measurements being made real-time, reconstructed from a CT scanner. Other quantitative measurements we can make are looking at these lung nodules in the patient's lung who's now responding to chemotherapy, and document not only in 2 dimensions but in 3 dimensions volumetric response to therapy. Another area of interest is, for instance, this patient who had a benign tumor of the mandible who is going to have plastic surgery performed. He's going to have a piece of his ulna removed and taken to replace the defect in his mandible. That volumetric measurement becomes essential in deciding in a decision-making on how to best treat this patient. Now, we're very excited about all the possibilities. We continue to want to move forward in what we're doing and using imaging, interacting with other silos out of healthcare. One of the new areas we're looking at is using three-dimensional printing, connecting our data sets to three-dimensional printers to allow us to look at disease sites in a most efficient and constructive way. Here's an example of a patient's aorta that was reconstructed from a data set and printed out on a three-dimensional. So I will leave it to your imagination to figure where this technology will lead to. As Einstein said, imagination is more important than knowledge. But technology by itself will not lead to anything without a great team of people working with you. And here is my team of people that helped advance the Plato's Cave platform.
Hello, my name is Rick Moore. I'm a patient at the Methodist Hospital. I'm a patient of Dr. Brian Butler, the chairman of Radiation Oncology. I had a base of tongue cancer back in 2006, and after going through a variety of doctors elsewhere, I found my way to Methodist Hospital, where I was pretty immediately diagnosed and entered a very harsh treatment that I'm glad to say worked. Back in, you have a lot of emotions when you are diagnosed with a cancer. You have a lot of questions as well. The emotions and questions are, am I going to survive? First. Second, what is my journey going to be from the time I'm diagnosed until the time I feel like, or even will know, am I going to make it long term? In my case, the odds were pretty high that they could get rid of the tumor, but not all that high that it would not come back. So after treatment, back in those days, we did not have these new ways like Plato's Cave to look at images. So the old way, you could certainly see there was something there that did not belong. By the time that I got finished with treatment, I could sort of tell it's not there. But with the new images, it's much, much better. You can look at with the new images, you can look at what was there and you can say, wow, that thing was big. No question you can see it. Also now, even more importantly, you can tell it's gone. It's just gone. Because of the treatment on the tongue, one of the symptoms is a little bit of funny swallowing. I will be that way the rest of my life. So from just the way I feel, there would always be that nagging doubt. Do I have another tumor? Did they really get rid of the original tumor? But with the new images, you can see it is gone. So from a peace of mind standpoint, Plato's Cave is just unbeatable. I carry images around on my iPhone so that I can show people and other doctors. I always go to another doctor for whatever. They want to know about my history. I tell them about my cancer. I pull out the images and show them on my iPhone, before and after. And it's pretty dramatic. So I'm very happy that I found my way here, and I'm very happy that Plato's Cave technology has allowed me to have that peace of mind.
This is actually the crux of the patient experience. As you can see here on this tablet, this is a head and neck patient. You're looking at the mandible here, the base of tongue region, and the cancer actually was located in the base of tongue. This was treated with chemoradiation, and as you can see in 3D visualization, the melting away of the tumor in the same area as prior. So you see a large tumor in the base of tongue region, and now you're very fortunate to be able to see the tumor completely dissolved in a normal base of tongue region. This is a view now from the side called a sagittal view. You can see the patient's vertebral column, the trachea, the base of tongue tumor, the mandible, the patient's eye and brain. Look how the tumor, rather large in the base of tongue region, is dissolved by chemoradiation and now a normal tongue and base of tongue area. This is our goal for personalized medicine with Plato's Cave.
As you can tell, the patient is the center of our department. The strategy for development of technology in the department, it revolves around the improvement in patient care. Thank you for listening today, and we look forward to new ideas and new technology in the future and discussing them with you.